Elderly patients who go through the hospital in just 275 steps per day have a lower recovery rate after 30 days, as the study shows. A study conducted in 20,062,007 among patients aged 65 and over, who are not dementia or delusional and are able to walk within 2 weeks of admission, showed that they spend an average of 83% of their time in beds in the hospital. However, according to Kovinsky, the policy has created an atmosphere of fear of falling in which nurses feel that if someone gets under their control, they will be held accountable. As a result, she says, patients are advised not to move and not to receive the necessary care. Efforts are being made across the country to encourage hospitalized patients to get up and move, often in special wards, in order to preserve the autonomy of older people and avoid disabilities acquired in the hospital. Barbara King, an adjunct professor at the University of Wisconsin-Madison School of Nurses, studied how nurses responded to intensive treatment from hospitals in order to prevent falls after a change in CMS policy in 2008. No falls were detected during the help site study, while staff or volunteers helped patients to move or walk. These alarms are designed to alert nurses to the need to ensure the patient's safe walking. But studies have shown that alarms do not prevent the patient from falling. After a few days in Ohio hospital, where she did not receive occupational therapy or physiotherapy, Twig was so weak that it took 3 months for he to walk and receive care. Rowley said. Nancy, AHA's vice president of patient quality and safety, said these policy changes are waiting for a strong signal to the hospital community about what the CMS has sent from us. Restricting patient mobility is clearly an unintended potential consequence, she said. Another initiative, the Elderly People's Hospital, which aims to reduce the delirium acquired in the hospital, also promotes mobility and has proven effective in reducing the number of falls. Although hospitals are obliged to report falls, they generally do not take into account the frequency with which patients get up or move. The research had shown that 1/3 of patients aged 70 and over left the hospital with more disabilities than at the time of arrival. In 2015, King conducted a nursing study to encourage more patients to go to hospital by 26 in the Midwest.